I went to medical school in London and worked for the Medical Research Council for a while. And I was trained as an endocrinologist.
Right.
But I got fed up with that, so I wanted to do cancer. And I wanted to do breast cancer. So I became a breast cancer consultant in about 2000. And in 1980 I came as a consultant here at the Christie Hospital in 1980.
Right.
And I also had a sort of scientific background as well, because I like cells.
Yeah.
So I'm a bit of my first degree was in cell biology. So I've got a degree in cell biology, a degree in medicine. And so that fits very well together into cancer.
Yeah.
And then we set up lots of projects when I came here in 1980.
Yeah.
And we set up the Manchester Breast Centre a bit later, and we've got about 18 principal investigators in the Manchester Breast Centre now. So actually, tamoxifen was invented in Manchester. The first patient was treated not 200 yards away from where we're sitting now.
Wow.
And then we developed this thing called the pre-surgical model. So we gave tamoxifen before women had their surgery for breast cancer. And this showed us how tamoxifen was working on the breast. But it now is very widely used. That was the first study I did with Andrew Belden. Andrew did the work. And now it's a widely used model to test new drugs or to find out the way that the drugs that we already use work. So you give it for 2 weeks before surgery for breast cancer.
Okay.
After tamoxifen, we needed to get a drug which was better than tamoxifen, so we developed a drug called fulvestrant, and that was first used in a window trial to start with. But now it's widely used, and it's the best treatment for advanced breast cancer. It's what's called a pure anti-estrogen.
Right.
So we initiated those studies, and then we with AstraZeneca developed anastrozole, or Arimidex is its trade name, and it was decided that we needed to see whether that was better than tamoxifen or not after surgery for breast cancer. So we did the ATTACK trial, 9,000 women in the trial, and it showed that Arimidex was better, so that's become the treatment of choice for women after surgery for breast cancer, and also works very well in advanced breast cancer. So that's a new treatment for breast cancer.
Yeah.
Yes, we were probably the first to set up a clinic for women at high risk of breast cancer, mainly by virtue of a family history, but other things as well.
Yeah.
And we set that up in 1987 at Withington Hospital, but it's now at Withenshaw Hospital in the Genesis Centre. So this is our focus for prevention. And so we've done prevention trials, and we showed that tamoxifen prevents breast cancer. And last year we showed that anastrozole prevents half of breast cancer. Arimidex and anastrozole, the one we use for the ATTACK trial. So that should be the new treatment for prevention of breast cancer. We're also particularly interested in diet for the prevention of breast cancer. We know that we showed some time ago, Michelle Harvey and I showed that women who were overweight and lost weight had about a 25% reduction in breast cancer. So that's led to our studies of lifestyle change to try and prevent breast cancer. So we do two things. We give drugs to prevent breast cancer, and we try and change lifestyle to prevent breast cancer. Yes, what advice would you give with respect to weight control? Well, first of all, I'd say don't gain it after about the age of 20, because we know that if you gain 20 kilos, you double your risk of breast cancer. However, if you're overweight, Michelle Harvey and I developed the 2-day diet, which is superior to a continuous dieting. We did a randomized trial and showed that 2-day dieting, which just 2 days a week out of the 7. That gives you twice the loss of fat, twice the rate, and twice as many people can keep at it. So that's really great, and it lowers insulin a lot. So we wrote a book.
Excellent.
And that became a bestseller for a while. So we're quite proud of that, and we continue to do lots of studies in weight control. And we're just about to start a study in advanced breast cancer with the 2-day diet plus chemotherapy. 2-day diet plus chemotherapy, or chemotherapy alone, to see whether that improves the outcome of women with advanced breast cancer. The key questions as far as breast cancer research is concerned: how's Manchester contributing? Well, the answer to the last bit is that Manchester is contributing quite a lot. What are the key questions? We've actually summarised that in a gap analysis which was published in Breast Cancer Research, and you can look that up. But we've also summarised in Breast Cancer Research, which is widely quoted now, the key gaps in our knowledge about prevention research. So we're particularly interested in prevention. I think that's where things will go in the future, to prevent all breast cancer. And prevention is better than cure because it saves the labour of being sick. I'm quoting a 17th century physician. That's entirely true. So I think we will define risk of breast cancer much more precisely, and my colleague Gareth Evans is particularly involved in this, defining new genes, for example. Second, I think we need to apply what we know. Tamoxifen and anastrozole prevent breast cancer, but it's getting it out now, which is the problem. And similarly with lifestyle change. And so that's where things will happen in the future. I think will be taken up by many more women, and we'll have a greater prevention of breast cancer. And then, what about treatment of early breast cancer when a woman presents with a lump? Well, I think that our screening will get better. I think we will have what we call risk-adapted screening, so that women at high risk will have more screening than those at lower risk, and we'll give them different screening modalities, because high-risk women often have dense breasts, which are difficult to see the cancer. Then, after surgery for breast cancer, I think we will have a new drug, a new anti-estrogen, based on fulvestrant, which we originally developed, which will be better than tamoxifen and better than anastrozole. And so I think that will reduce relapse rates even more. And then in advanced breast cancer, this is a great time of advanced breast cancer, because there are many drugs coming through. For example, Herceptin, which we introduced into this country, but that's an old drug now, but if you combine that with Tuzumab, we're getting women living for 4 years or more. And so this will develop and develop, and I think advanced breast cancer may change into a chronic, women who have the misfortune to get a relapse, we can convert that into a chronic disease. And finally, we've got some fantastic laboratory researchers in Manchester, and I think their findings, how to predict them I don't know, but their findings will clearly change the face of breast cancer as they have in the